Welcome to the I Am You podcast. I am your host, Dr. Nitza Alvarez, a board-certified cardiologist and best-selling author. My hope with this podcast is to share stories so women can speak up and become the CEO of their own health. I am a cardiologist. I am a wife. I am a mother. My story is your story. I am you. Hello, everyone, and welcome to another episode of I Am You. Today, I have been joined by the amazing and beautiful Miss Linda. Linda, thank you for being here today.
You're welcome.
Thank you for accepting the invitation to come and share with all the women that are connecting with us through this podcast, your history. Yes?
Yes.
So for the audience, I want them to know that your journey with heart disease started a while ago. You are only 60 years old. Is that correct?
60
no,
years
you're
young.
60 years young. I'm glad that you corrected me.
That is right.
Because you know that's the one thing that I'm like, no. So 60 years young.
Yes.
But you were diagnosed with heart disease how long ago?
Oh, 15 to 20 years ago.
So that means that you were super extra duper young.
I was.
Yeah, in your 40s.
Yes.
And do you want to tell the audience, like, what was happening then? How did you ended up finding out that you have a heart problem? Because I think that when we think about heart disease, our women think that this is a disease of the elder. Yes. And so many of them don't think about heart disease when you're in your 40s having symptoms. So how was that for you?
So the way I first found it, I'd had high blood pressure since I was 30. And so I'd seen a cardiologist. They kind of, you just have high blood pressure. But in my mid-40s, I was really not feeling well. And my chest was heavy. I just was exhausted and didn't feel good. And got to the point where my primary care doctor said, you need to go to the ER now.
Because that's how bad you were feeling.
That's how bad I was feeling. And the ladies in the office with me were like, Linda, you don't look well. You have got to go. And they wanted to call an ambulance. I said, well, I am not going to the hospital in an ambulance. So my husband came and got me, went to the hospital. And, they do all the heart stuff and the blood and all that. And they're kind of like, don't know why you're having this. They put a nitro patch on me. And that took my chest pain away. And did some more tests. I ended up doing where they run that little light up your groin and looked in your heart and all that.
They did a coronary angiogram or a heart cath?
Yeah, heart cath. And so they did that, and the doctor's just like, and I said, so what is it? And he's like, well, you're working, you're mom, you're all this stuff. It's just anxiety. I said, but whenever I have the nitro patch on, it doesn't hurt. And he says, but it's just anxiety. I'm going to give you a nerve pill and you can go home.
My blood boils when I hear that because, when you were telling me the story and I said, oh, well, I didn't know that nitro patch treat anxiety. That's a new indication. So we should be adding that into the nitro bottle. Say, if you suffer from anxiety, feel free to put this tablet under your tongue. That's going to help with it. And nitroglycerin is strictly to cause relaxation on the arteries. And we use nitroglycerin to treat chest pain coming from the heart. Yes, so angina. So you are in hospital bed, getting treated. They investigated your heart even in more in depth because they were suspicious that your symptoms were coming from your heart. But once that coronary angiogram comes back, no blockages. Then now it's a puzzle in everybody's head. And instead of searching for what other mechanism, which we emphasize a lot in this podcast and the material that I have created to educate women that a normal coronary angiogram doesn't mean that you don't have coronary artery disease. It only means that you don't have a blockage. So it means that there is a different mechanism. So when you have nitro and you feel better, it's definitely because your arteries are getting relaxed. And now they're trying to attribute that to anxiety.
Yeah. And I told it to you, but I didn't say to them, I'm like, nitro patches solve anxiety. Well, that's very interesting. But it didn't give me any answers, because then they're like, well, here, I'll give you a nerve pill. And I'm like, but what about my chest pain? And he's just like, I don't know. And so I went back to my primary care doctor, which I could talk to. And she says, who did you see? And I said, gave her a name. And oh my God, is he still there?
Is that like an old person?
He wasn't particularly old, but my primary care didn't care for him because
dismissed the fact that a woman can have a heart problem even if they're different. Yeah. Somehow, your primary care doctor knew that he was not paying attention to your whole. No, it was more like, it's not this, and go.
Yeah.
Okay.
And she says, you need a different cardiologist, because I guess she'd had experience with other patients. And he did not work well with female patients. Anything that wasn't a big, obvious, here's the problem, there's a blockage, or there's this. It was just, the weaker sex. That's how. The
code word is anxiety, is stress. Yeah, that's a code word. That's a code word to say, this is just in your head. Yes?
Yeah.
And unfortunately is something that we have to keep talking about it, because when our audience hear the word coming from a provider saying, or you're just anxious, I want them to have like red flags all over and alert. That is a code word for saying this is just in your head. Granted, it is important to always consider the stress in our lives, but without the proper evaluation and diagnosis, and just telling you, take this anxiety pill, the studies are clear that women receive more anxiety pills than men, and we get more anxiety pills prescribed by male providers. So you nail it right there. When it's not clear cut, when they don't understand, then it just flip into, it is just in your head, and just take this chill pill and you'll be okay.
And it really messed things up for me for quite a while. It made me scared to go to the gym. I would go to a gym where there was nobody there. It's unmanned. You scan your card, go in. And I was like, what if this happens again? What if I'm here by myself? And it's worse. And I was scared to exercise. I was scared to do things. I lost my physical conditioning because I wasn't going to do anything till I found out what's really going on, and is this really just anxiety that I can't handle life? And so I had to get to a doctor that would listen to me and tell me, you need to do something different with your anxiety, or there is a heart problem here that we need to fix.
So you modified your lifestyle around your symptoms because you were afraid.
Yeah.
And still not knowing, do I have or I don't have it? And also, I think that is actually a gray zone of like, well, if I have it, I want to know, but if I don't have it, do I really don't have it? Is it really just anxiety? Is it really just in my head? And sometimes it makes you wonder to the point that you question yourself, and that's how we ended up burying so many women, is precisely because then now they're questioning, is it in my head? Maybe it is in my head. Or maybe, yes, I'm stressed out. But who is not stressed out anyways?
Yes.
We all have our lives. And as mothers and spouses and daughters, so many times our plates are so full, and it would be foolish not to think that stress can get to us, but to use it as an explanation to how nitroglycerin patch work when you're anxious is definitely not a good anxiety medication.
Yeah.
So how do you end up finding out what was going on with you?
So my primary care picked out a cardiologist for me, a female cardiologist. And I went and talked to her, and she goes, I'm sorry you had to go through that.
Oh.
She goes, that should never have been said. That is not your problem. And she was like, yeah, sure, everyone has stress, everyone has anxiety, but there's something causing this. You don't just get chest pains that are taken away by a nitro patch because you have anxiety. I said, phew.
It's just like a weight come out of your shoulder, because now it's not in your head.
Yes.
And because once you know, that there's a problem, then you can fix it.
Yes.
Yes.
And once I felt like I was listened to and I can do things and I don't have to worry that there's something else going on that no one's looking at. But I lost a lot of my conditioning. And it took me a long while to get back to the gym, which is not a healthy choice. So one little visit to the hospital to a bad cardiologist messes things up for me.
So
for a
here
long
you
time.
are with a cardiac condition that you will benefit 100% from staying physical, staying in shape, and then the opposite happened. It's like, now I'm scared. And then that push you to the other end of like, now I'm not doing anything. I'm not caring for myself. Not because you didn't want to, but because you didn't want to end up having a heart attack or dying alone in a place that when nobody can actually help you.
Yes, it was a scary time for a while, and eventually, after getting with a better cardiologist that listened to me and started working on medications, we got to where and with you, I don't use my nitro pills anymore because the medication regimen is the right one to make me feel good. And I'm back to the gym, I'm exercising, I'm eating healthy, I'm doing all the right things now because my doctor listens and makes me feel like I can go do any of these things. Nothing is going to stop me.
Perfect. So, Linda, I think that you hit a point there that we also emphasize in our programs, which is you have to make sure that you have a provider that is listening to you. So I know that sometimes we are afraid of speaking up, but many times we're not afraid of speaking up, and it's just that we're not being heard. Yes? So then you have to be willing to seek care elsewhere. And I am so glad that your primary care providers prompted you to we're going to get to the right provider. So it takes a village. We had to have providers that understand that heart disease in women is different, that understand that the treatment is different, that the presentation is different, that their risk factors are different, but also you need providers that know where are they. Yes,
That's
because
right.
your primary doctor had to send you to this other provider that knew exactly what was happening with you, and was a very important piece on your journey to help you recover your confidence and your confidence that you were going to be okay, which I think that there's nothing more important than have the peace of mind of I'm going to be okay. Yes, because it's treatable. What you have was treatable. But if you didn't treat it, you can end up back in that hospital bed again.
Absolutely. And especially if I didn't get to the point where I was doing the right things, the healthy choices again. And I needed somebody to give me that confidence that I was going to be all right if I go and push that workout and try to get back to that physical fitness that I had. And so it made all the difference. And it made a difference, that cardiologist made a difference in future doctors, because whenever I moved from Missouri down here to Florida, went and found a doctor. The doctor ended up not being a good fit for me. And I was like, no, I can find somebody who's going to listen to what I have to say and hear me and say, okay, yeah, this is where we need to go, not just, go do this. And
so that experience, although sad, the original one gives you empowerment
Absolutely.
to become your own advocate, because then you realize that there's people out there that I can become partner with them, that they will listen to me, that they will meet the criteria for what a good provider means to you. And when you encounter another one that doesn't meet that criteria, you're like, I don't have to settle for this.
That is right. That is right. Find someone who listens to you is what is my theme. And I've actually made referrals. Somebody you saw this morning to you. I said she will listen. She will listen. She will help you, and that's important. And I agree with me. I don't go, oh well, the doctor said that. That's what it is. No, I don't agree with that. I'm going to go find a doctor who's going to listen to me, and who's going to help me. That if I say this is what's bothering me, they're not going to be like, yeah, well, you're getting older. No, I'm not. No.
And I always, this is one of the things that we prioritize. Of course, it's always when you advocate for yourself, for your health, for everything. At the same time, it's like, it's okay to seek a second opinion. No, it's okay to look elsewhere and said, is it right? And I said, sometimes it's not necessarily that it's right or wrong. It's like you need to feel that you were heard and that you feel comfortable with the plan that is being designed for you. But it's okay to question, because if you still feel that thing inside you that tells you, I'm not sure. Yes, I'm not sure this is it. What is the worst that can happen? That we have 2 or 3 people coinciding on a diagnosis? Okay, perfect. So then I guess that's it, no?
Yeah.
But don't settle for one particular answer just because you're afraid of asking or afraid of looking elsewhere. And I think that sometimes the issue is that many women assume that because they have not been heard, or who can guarantee them that the next provider is going to be a better provider? Well, nobody can. But if you don't try, if you didn't try, you would not have the care that you deserve and you needed.
Yeah. And I'm okay with asking doctors questions about what they're saying. You know, and they might go, well, that's a stupid question, although I've not heard that yet. But we do need to ask. Because if I'm not sure, like, oh, I don't know about this thing that she's wanting me to do, a lot of times if I ask the questions now, a lot of times I come around to what the doctor said because, okay, now I understand why you're telling me that. And now it makes sense. But if I just take everything at face value, I have to question.
Yes. And asking also, like you said so beautifully, more often than not, I end up doing what they need me to do, but now I understand why I'm doing it. Yes? And that creates such a big difference in also engagement, because we have the knowledge, we have the preparation, but if you don't understand why you're doing something, if I'm giving you a treatment or if I'm giving you a recommendation, but you don't understand why, we know statistically there is a very high likelihood that you are not going to comply because you don't understand.
Yeah.
But if you do, then you said, okay, I know exactly why she wants me to do this, and you had to agree or disagree to do it, but something has to happen. No? So at least you know
Understand the
why
benefit.
am I doing it? Why
Yeah.
am I doing it exactly? So I do not want to leave without asking you. This is a personal question, but it's okay because we're here talking personal. At what age did you had your menopause?
So I had a hysterectomy at 27.
And the reason why I asked this is because you started with high blood pressure early. And you said around 30, you were already taking blood pressure medication.
Followed by high cholesterol. And I was the healthiest eater around.
Did they remove your ovaries?
They took out one with the hysterectomy, and 3 years later had to go take the other one out because it was a mess.
Gotcha. So
that was by 30.
That's precisely what I asked. Because, as we understand more and more that heart disease and our estrogen levels, as they go down, our heart disease risk increases. Then when you mentioned at 30 I was taking hypertensive drugs, I started thinking, there has to be a hormonal issue involved in there. And normally is early menopause. And for you, it was a very early menopause.
Yes.
So for the audience, please, I cannot emphasize enough that if you are in your perimenopause, anywhere between 40, 48, if you are in your menopause, it's super important that you have a conversation about hormones and that you have a conversation that you get a cardiac evaluation, because the sooner we can get you, the better we can care for you rather than waiting until it's too late.
Yes.
And you agree?
Absolutely. I would much prefer to have gone to a cardiologist office and had all this taken care of prior to the 5 days in the hospital with all the tests. If they could have found it before it got that bad, it would have been a much better experience.
Yes. Well, Linda, I am so grateful for you. Thank you for accepting the invitation to come here today.
Well, thank you for accepting me as a patient, because you are wonderful. And anyone who's listening should know that if they're around here, you're the doctor for the cardiologist for anyone.
Thank you. Thank you for that.
You're welcome.
And this takes us to an end of another episode of I Am You. Thank you for joining us. I hope this episode has empowered you to be the CEO of your own health. Tune into our next episode, and don't forget to follow us on Instagram and Facebook at NITZAMD. To explore more on this and related topics, visit our website, NITZAMD.com. If this episode resonated with you, please like and subscribe. And one more thing, share with the wonderful woman in your life.